Hello everyone, let's get started. Today we're going to be talking about cancer. The term cancer actually translates as crab or crab-like. If you're familiar with astrological signs, you know that Cancer is one of them. It's believed that at some point in ancient medical history, a scientist or a physician described a malignant tumor as looking something like a crab because within the body, malignant tumors don't tend to be nice and round and symmetrical. They tend to send out projections and tangle themselves in with normal tissue, the same way that the body of a crab sends out lots and lots of little legs. So this word cancer, this term cancer, became associated with this disease of malignant growth. The cells inside a cancerous tumor are growing in an unregulated, unchecked fashion. These are cells that have escaped the normal regulatory mechanisms that would destroy an abnormally dividing cell, that would send such a cell into apoptosis or programmed cell death. One of the key features of cancer is this process called metastasis. All metastasis is a spreading of cancerous cells from the site of the original tumor on through the bloodstream or the lymphatic circulation onto distant sites. You may be familiar with the fact that there are certain places in the body where metastasis is likely to form: the lungs, the liver, and less commonly, places like the brain and the bones. It's important to know, though, that metastasis can occur anywhere in the body. This word tumor is defined as an abnormal growth of cells. So it's important to know that just because something is a tumor does not make it a cancer. You probably have, for example, at least one mole somewhere on the skin of your body. A mole is an abnormal growth of cells, and it is technically a tumor, but it is certainly not a cancer. So we can break down tumors into two groups. We can break them into benign and malignant growths. A benign tumor is a tumor that grows locally. It is unable to invade neighboring tissue, and it is unable to spread or metastasize to other sites of the body. A malignant tumor is a tumor that can invade neighboring tissue and can spread through the body. A malignant tumor, therefore, is a cancer. The next couple of slides show some images of actual cancerous tumors. If you would rather not see these, feel free to skip ahead. On this slide, up at the top on the left, we're looking at the skin on the back of a human being, and you can see that the skin is covered in these brown spots of varying sizes. Some of these might be considered freckles, and some of them are moles, and some of them may actually be other types of growths, other types of tumors. Skin doesn't normally have these kinds of growths on it, but many of us have these growths present on our skin. These are benign tumors. Over here, next to that image, we can see pictures that were generated through an MRI of a human brain. This is the brain tissue here in this gray color. And I think you can see quite clearly that there's something right here that doesn't belong. This is a tumor inside the brain. This is just another image at a different level of the same brain showing the same tumor. Now, it's very obvious that this tissue is different from the rest of the brain tissue, and it's quite alarming to see it in an image like this. But believe it or not, this is a benign tumor. This is a tumor that is not capable of invading into the nearby brain tissue. It's not capable of metastasizing, but that doesn't mean it's not problematic. So one of the things that's important to remember is just because a tumor is benign doesn't mean that it doesn't have to be dealt with. Because while this tumor cannot invade neighboring tissue, it can't send out those little crab leg projections that malignant tumors are famous for. It can certainly keep getting bigger and bigger in size, and it can crowd out the normal brain tissue. So this is a tumor that a physician would want to deal with, would want to try to get rid of, even though it's benign. Another example of benign tumors is down here on the lower left. What you're looking at here is an image of the lining of the gastrointestinal tract that was taken with a camera that was inserted with an endoscope. So this patient would be sedated, the endoscope would be passed down through the mouth, through the esophagus, and into the stomach and intestine. You can see that while the surface of this tissue is nice and pink and glistening, there are all of these sort of round and oval projections coming off of the surface of the tissue. These are what we call polyps. These are benign tumors. Here's the scope itself, this black thing right here. These polyps, although they are benign, are often a sign to a physician that this patient may have some sort of an abnormal process, does have an abnormal process going on in this tissue, because polyps are often a precursor to more advanced metastatic disease, cancer. On this slide, on the upper left, we're looking at a woman's face. You can just see one of her eyes right here. Her nose is over here. You can see her cheekbone right here. And there is a rather large, dark tumor on her face, an abnormal growth of cells. This actually turned out to be a melanoma, which is a malignant cancer of the skin. Over here, you're looking at the abdomen of a dog. So the dog is laying on its back. Here's one rear leg, here's the other. Its forelimbs are being pulled this way. Its head is out of the shot. We're looking at the abdomen surface right here. And here's the surface of the thoracic cavity right here. And I think you can see this. This is a mammary tumor. This is a female dog, and she has a large mammary tumor visible. In the canine, there is a chain of mammary tissue that runs all the way up the length of the ventral surface of the abdomen. And there's another chain that runs all the way up here. You've probably noticed, if you've ever rubbed the belly of a dog, that there are several pair of nipples that run up and down the surface. And each one of those nipples is associated with mammary tissue. This dog obviously has an abnormal growth right here. This is a mammary tumor, and unfortunately that tumor turned out to be malignant. I put the picture in though to remind us that humans are not the only animals that can get cancer. We should also remember that animals are not the only organisms that can get cancer. Plants are also susceptible to malignant, abnormal tumor growth. Down on the bottom here, this is another animal example. This is the kidney taken out of a cat. The kidney has been sliced open so we can look at the cut surface on either half. Most of this tissue looks pretty normal. This right here is what's abnormal. This is lymphoma. There's the other half of the tumor over here. Unfortunately, a malignant tumor in this cat. Malignant tumors or cancers are diagnosed not just by looking at them grossly, but by examining cells taken out of those tumors in the laboratory under the microscope, because it turns out that cancerous cells have traits that you don't find in normal cells. On this table, you're looking at some of the more common features that we find in a cancer cell that are considered abnormal. So in this first column, we're looking at a couple of examples of normal cells. And in the middle column, we're looking at a comparable cell, but that has undergone the changes associated with cancer. And finally, in the third column, we're looking at these traits that a pathologist looks for under the microscope. So when you compare these normal cells on the left to these abnormal cancerous cells here, one of the things that jumps out at you is that the nuclei in the cancer cells is quite enlarged. And it's not particularly symmetric. It can vary in shape and size from cancer cell to cancer cell. If you look at the nucleus over here, these happen to be squamous epithelial cells. These are the kinds of cells that you find lining cavities of the body, for example, and lining the surface of the skin. The nucleus is very small, it's very dark, it's round, it's symmetrical from cell to cell. When you compare a cancerous epithelial cell over here, you can see it's greatly enlarged, and it is not particularly symmetrical. It's got this weird projection right here. The border is very bumpy as you go around. It's not the same size as this nucleus in the nearby cancer cell. This is a common feature found in malignant cells. Large, variably shaped nuclei. Another thing that's commonly seen in cancers is that the cells, because they tend to be dividing so rapidly and in an uncontrolled manner, they are disordered in their arrangement. Normally, when we look at tissue, in other words, a collection of cells, underneath the microscope, the cells are arranged in a fairly orderly way. They lie side by side, they don't overlap each other. Again, all the nuclei are about the same size, quite symmetrical. When you compare that to a cancerous tissue, the cells look very disordered. They're not growing neatly. They're not growing side by side in an orderly way. Of course, each one of these cells looks different from the other. The nuclei are quite enlarged and irregular. So, disordered, disorganized arrangement. Another feature is just the size and shape of the cell. We come to expect different types of cells to have a particular size and shape under the microscope, and what happens in cancer is the cells just lose that expected trait. They start to show evidence of being much larger or much smaller than normal. This is a trait that's quite common in cancers. And finally, we see a loss in normal features inside of a cell when cancer develops. We normally expect to see the nucleus if we're using one of the common stains. We can't see a whole lot of organelles, but we can see certain other internal features inside of a cell under the microscope, and we expect to see those features every time. When we look at a cancer cell, everything just looks muddled. The nucleus doesn't look like a nucleus. The cytoplasm doesn't look nice and smooth and regular. There are things that appear that we don't expect to see. We just see a loss of normal features. What I'd like to talk about next is how we discuss cancers, how we name cancers and classify cancers, because cancer is a very variable condition of cells. The first way we classify cancer is simply by its site of origin. Remember that cancer can originate in any type of tissue. We haven't talked about tissue types in this course, but I think we mentioned briefly that there are 4 types of tissue in the human body. There is epithelial tissue, there is connective tissue, there is muscle tissue, and there is nervous tissue. So 4 types of tissue, and cancer can originate in any of those 4. You've probably heard terms associated with cancer that tell you the site of origin. For example, the word hepatic means liver. The word renal means kidney. Pancreatic, colorectal, which combines colon and rectal together. You've probably heard neuro at the beginning of the name of a cancer, and neuro just refers to nervous tissue. So, the site of origin is included when we classify a cancer. We also classify the tissue type, but not using that 4 tissue system. Instead, we talk about cancer as being either epithelial origin or non-epithelial origin. And the reason we do that is because 90% of all cancers are epithelial tissue in origin. All of the remaining types of tissue, connective tissue cancers, muscle tissue cancers, nervous tissue cancers, they only constitute 10% of cancers. So we use the term carcinoma when we're talking about a cancer that originated from epithelial tissue. For all of the other tissue types, we would refer to that as a sarcoma. So we have to know a few things about epithelial tissue, since these are the types of cells that most commonly become cancerous. Epithelial tissue lines the cavities, the empty spaces that are within our body. And of course, it also covers the external surface of the body. The integument, or the skin, is epithelial tissue at its outermost layer. So, lung cancers, breast cancers, colon cancers, stomach cancers, uterine cancers, bladder cancers, all of these are organs within the body that have cavities. You may not think of breast cancer and first imagine a cavity, but you have to remember that the breast tissue contains glands that make and secrete the milk, and that glandular tissue has an open space within it, has a cavity within it, and so is lined with epithelial tissue. All of those types of cancers are carcinoma type. Now compare that to a cancer of the bone or a cancer of muscle. Those are sarcoma type. Any cancer that arises from connective tissue, muscle tissue, or nervous tissue is considered a sarcoma. Now I have a little asterisk here next to connective tissue because while it always surprises people to hear this, blood is considered a connective tissue. And we'll talk about blood cancers next because they go with a little bit different terminology than sarcoma. So when we talk about blood cell cancers, we use two different categories. We talk about lymphoma and leukemia. The difference between those is whether or not there is a solid tumor present. So a lymphoma is a cancer that involves a solid tumor, one or more, of blood or lymphatic cells. A leukemia is different. In a leukemia, there is no tumor. There is no mass of abnormally dividing cells somewhere. Instead, it's the individual cells that are cancerous, individual cells of the blood and the lymph that are cancerous, and they circulate in the bloodstream. So, site of origin, tissue of origin, and also extent of abnormalities in the cell. This is what we often hear described as staging of cancers. I'm not going to talk a lot about staging because unfortunately, the way we stage cancers is different from cancer type to cancer type. But what you should understand is that the reason that we stage cancers, the reason we talk about, say, a mammary carcinoma stage 2 or a hepatic carcinoma stage 1 is because it tells us some information about how extensive the abnormalities are in the cells. Generally speaking, the higher the stage, the worse the abnormalities.